Yeah, exactly. Does this surprise you, or does it surprise you that it's not happening as much anymore, like it, than it used to?
Well, I like to keep it simple, like evangelicals do. You know, and of course, nothing is simple. So, yeah, it doesn't surprise me, but it's always disappointing, isn't it? I don't know. I don't know what people. In order for the world to change, about 95% of people have to just fuck right off, right? As
Yeah.
far as I'm concerned, right?
Nuke 'em.
And and without that, we're pretty much doomed, and unfortunately, yeah. So no, it
I'm
doesn't surprise me, Andrew, and it's a shame, and it's silly, but all I can say is some of the best care I've ever had, in a hospital was non-white care, I must say. And it's probably the most available, the hospitals, in Canada anyway, when I had my heart surgery, were the most diverse, culturally diverse,
Mhm.
institution imaginable.
I mean, there's been a whole
Imaginable.
shift in
Yeah.
who's actually giving medical aid. And I think, and I'm not sure on this, when am I ever sure, but it's a question of what you're accustomed to. I don't think, especially folks coming out of rural environments and with hospitals closing all over the place, having to come to the city for care, where the demographics of the healthcare system have radically shifted racially. It's a huge shock for them. I think most, and I don't know this, but I would think there's a higher percentage of urban white folk who have become accustomed to it and don't have an issue with it.
You know what I experienced, which is a bit of the opposite. Like, I had to go for an exam, and they had every now and again they get students to do the pre-exam thing, So every now and again they'll get a student to look at your knee or whatever needs to be looked at, and then they report back to the doctor, and then the doctor says, "Okay, did you look at this? Did you look at that?" I had a Muslim woman who had to check me out, and she was really struggling with the fact that it's a naked man in front of me, and wow, like, or a man like with a blue thing on that I'm supposed to examine. Yeah, exactly.
Is it because of that knee knocker black thing? Huh? Huh?
I tucked it. It's okay.
Do
I
you
tucked
have a picture?
But no, like I really felt for her because I could see that there was a sincere struggle happening within her with her faith and with her job. And I was looking at her going, "Oh, my young friend, you're going to have to
How
figure that
good
out."
do you look naked, Moody? Oh, it's time. It's time.
Yeah.
Oh, you know what?
2 words and
you-
2 words only. Green Speedo.
No. 2 words. 2 words only. OnlyFans. Okay. Check out my OnlyFans. But yeah, no, I mean, I also, like, there are lots of different religious doctors out there from all the different religions in the world, and they struggle with it. And I think that, does a patient have a right to say, because I know what it's like to say, you know what, actually, I'd like a male doctor to look at my stuff because I think a male because I was about to do a Bill Cosby impersonation. Bad
Wow.
idea. Bad idea.
Yeah.
Oh,
Yeah. But because I've had female doctors check out the guys, and there's just a cognitive disconnect. They just don't. There's some functional things that for certain things I can understand a woman saying, you know what, when it comes to gynecology,
I will admit,
I
one
want a
time
woman.
this happened. One time it was just like a checkup of whatever the fuck, and then I was just sitting like you do. You sit on the, I'm like, do I sit on this white fucking toilet paper shit? Like, what is it? I was just sitting on, and then this like gorgeous, she looked like a model doctor comes in, and I literally just went, hello, and I was like, oh no, and her face. Like, and she like left the room, and I was like, "No, I'm that guy."
Yeah, you are.
Yeah.
You are.
It never happened since, but it was like so shocking. I was
Oh
like,
my God.
"What is this?" I mean, I'm punked right now.
Yeah.
The dick do speak.
Oh my God.
Just wish
Okay.
like,
They, but
oh my-
in the 70s, they would carry a pencil, right? The women
Yeah.
doctors and the
Mhm.
nurses, right? And if you sprung one, boom, right on the end, and
What?
dealt with it. Yeah.
Was that a
Mhm.
thing? Was that
That
not
was the
a thing?
thing. Yeah,
You
yeah.
could get
you
your
count
dick
on that.
slapped really
They were
easy.
very good about that, and you'd be very grateful as a man, right? Oh,
Yeah.
good. Thank you for
Today-
doing that.
Today I'm learning so much. I'm learning how female doctors in the workplace are doing way more above and beyond than they need to. And Andrew's accents fall into two categories: racist and problematic.
What?
So they're one of the.
Oh, here we go.